Hi there, I'm Christopher Westfall. I'm a licensed insurance broker specializing in the world of Medicare. And today, I want to take you inside a few seminars happening around the country right now. As I record this, we're in the middle of the annual enrollment period for Medicare, which does not affect Medicare Supplement, incidentally. If you have a Medicare Supplement, Plan F, Plan G, Plan N, no one's taking away your coverage, and you don't have to do anything to renew. They automatically renew. This is for Medicare Advantage folks and for Part D drug plan folks. That's who's affected by the annual enrollment period. And we want to drop into a couple of seminars, pick up on a couple of key points. And you might be asking, what could I learn if I go down there to that seminar that I've heard advertised? What could I learn there that I could not learn on YouTube, which is the place where intelligent people go to get their news and information? Well, the answer is pretty much nothing because we've covered it all, but let's drop into a couple of seminars. This is a very sharp fellow in Texas who's educating a room full of doctors on how exactly Medicare works.
These Medicare Advantage plans, they become your Medicare. If somebody signs up for Humana, Aetna, or WellCare, that's their Medicare. When they come to see you, they hand you their Humana card. And you bill Humana, they pay you, they provide the benefits. Medicare's not paying anything. And so these Medicare Advantage plans, known as managed care, are also the HMOs and the PPOs. And I know you all...
Nothing new there, right? And yet continually in the comments on these videos, which I encourage you, please like and subscribe and leave a comment if any of this affects you. Agents will still, from time to time, they continue to be brainwashed, I guess, by the AHIP training that says that when you're on a Medicare Advantage plan, you still have your A and B. Your Medicare Part A and Part B. Yes, you are still paying for them, but you are not using them the way they are available to everyone else. Part A, in the hospital, you can choose any hospital. Part B, everything outpatient, you can choose any provider that accepts Medicare. No, you still must maintain those payments, but those payments are going to the Medicare Advantage company, the HMO, the Medicare Advantage company that you choose. More on that in just a minute. But I'm right, and this agent just says the exact same thing, that for all intents and purposes, these companies are your Medicare. Now, true original Medicare maintains the highest hierarchy and the level of appeals that you can appeal things to if you don't get the referrals, pre-authorization, surgery scheduled, all the things that you need. You can go through 4 layers of appeal. Hopefully you're healthy enough to do that and you don't ever have to go through those horrible scenarios. We've covered a few of those in past videos, but let me skip ahead and see what he says right here.
Why don't you go to the next slide?
Medicare Supplement plans.
So I said when you sign up for Medicare, you can either sign up for the red side or the blue side. I've been talking about the blue side, a Medicare Advantage plan. The HMOs and the PPOs. You have to use a network. They might have copays. A Medicare Supplement is the other option. A Medicare Supplement, by the name implies, it just supplements your Medicare. So if you have a Medicare Supplement, and let's say you have a Humana Medicare Supplement, Plan F, you might hear about that. Then Medicare pays 80%, your supplement pays 20%, the patient pays nothing. A Medicare Supplement allows you to go to any provider in the country that accepts Medicare.
Where have you heard that?
Virtually everyone.
Virtually everyone.
And it's more expensive, whereas a Medicare Advantage plan might be $0. A Medicare Supplement is based on your age. A Medicare Advantage is not. So you might pay $100 a month at age 65. You might pay $200 a month at age 75. So it goes up every year. And during the Medicare open enrollment, people can switch from a supplement to an Advantage plan. So you might get patients that, I've had some of your patients call me in the last couple of weeks say, I have a Medicare Supplement. Can I switch to an Advantage plan during the open enrollment? Absolutely. No waiting periods, no pre-existing conditions, no medical underwriting. You have a 7-week window to make that switch. If you don't do it in those 7 weeks, you have to wait till next year. So when you're eligible for Medicare,
and remember the other part,
6 months. When they come to see you, if somebody signs up for Humana, Aetna, or WellCare, that's their Medicare. When they come to see you, they hand you their Humana card.
So as often as during this time of the year, we'll have people that are picked off. They had a Medicare Supplement plan, and for whatever reason, they've watched the news, the indoctrination. If you watch the news for any length of time, I mean, just walking by my television today, or was it yesterday? These days are running together during AEP. Walking by, you see every commercial, whether it's Fox News, CNN, doesn't matter. It's all about Medicare. So people will get lured into that, or they'll get a Part D drug plan, which is a standalone Part D drug plan to complement their Medicare Supplement and have full coverage. And then the Part D drug plan will call them and say, did you know you can get a Medicare Advantage plan for 0 monthly premium? I know you're paying a premium for the Part D plan, but what if we roll all of it into one plan and there you go. You've got all this coverage. What he said here cannot be overstated.
Somebody signs up for Humana, Aetna, or WellCare. That's their Medicare. When they come to see you, they hand you their Humana card.
Right. So if you're going from a Medicare supplement out of the world of regular Part A, Part B, Medicare supplement, the freedom, remember all the stuff that he put on the board up here? Let me see if I can zoom back in there. The freedom to choose doctors. Now you can see any doctor in the United States. No network restrictions. Guaranteed renewable for life. It doesn't change every year like an Advantage plan does. No medical underwriting if you apply within 6 months of getting Part B, but the medical underwriting itself is not that onerous on you. And supplement plans just pay the claims. Understand, if you do use the annual enrollment period to go from original Medicare, from a Medicare supplement, into a Medicare Advantage, that will start on January 1. And then there was so much blowback to the government that they had to create this period called the disenrollment period. And that they didn't like that word, the industry. They changed it to the new open enrollment period. It's so many weird terms that just don't make any sense. During the open enrollment period that starts January 1 to March 31 next year, that's for people who've found out that they're on a Medicare Advantage plan and literally found out that they're on a Medicare Advantage plan. And by that I mean they've actually tried to go use it and then had second thoughts about it. And for whatever reason, they need an opportunity to get back onto original Medicare. They said, nope, 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 get me off this plan. So yes, during the annual enrollment period, that's October 15th through December 7th, you can choose to get onto a different one or a new Medicare Advantage plan. Or you could get off of a Medicare Advantage plan for January 1 if you can get medically qualified over on a Medicare supplement. We've got a lot of people to call back about that we're working through right now. But for January through March, that's another period in which if you are on a Medicare Advantage plan, you can choose to go back to original Medicare, pick up a standalone Part D plan, but hopefully, and this is my advice, get approved first over in a Medicare supplement so that you're not just exposed to regular old Medicare. Part A and Part B. Remember, Part B of Medicare is where you pay for 20% of all the bill, and there's no limit to that. There's no cap to that. So you need to get a supplement in place. Get the approval for the supplement always before notifying your Medicare Advantage company. We had one yesterday. I had to write them an email and say, no. They said, I'm ready to fire off my letter to my Medicare Advantage plan. Ready to get off that plan. No, don't do it until we have the approval at the Medicare Supplement company. Because if we go through health underwriting, it's not just a foregone conclusion that you're going to be approved. It's something we have to wait for. And they always get backed up during this time of the year, so we may have to wait a week or 10 days. Anyways, the good information here from him about the benefits and the differences between Medicare Supplement and Medicare Advantage. I'm going to drop in now to a community meeting taking place, and this is going from people that work with SHIP, that's through the government, state-run organization with volunteers and everything like that. This is in a library. And I want to talk about a word that she uses up in here. Let me skip ahead to it right about here.
That's an option. Or you can get a Medicare Advantage plan. That's Part C. Remember, we said we'd talk about Part C a little bit later. Part C is a Medicare Advantage plan, which is usually a private HMO or PPO plan that basically takes care of all of the Part A, Part B, and Part D.
That word basically is a word with a ginormous Grand Canyon-like cavern in between what the B is and the Y is. Basically, it's the same thing. Basically, it takes care of the Part A. Basically, it takes care of the Part B. Small distinctions. Part A of Medicare, if you have the original Medicare and the supplement that she mentioned there in about a 2-second blip, Part A lets you go to any hospital. Any procedure that your doctor says you need to have, hip surgery, knee surgery, gallbladder surgery, appendectomy, whatever the procedure is, if your doctor says it's medically necessary and there's a Medicare code for it that can be distinguished by the diagnostic code and the approval code with Medicare, it's covered. And you get to pick your facility. The basically part is if you have a Medicare Advantage plan, basically you have to go to the hospitals that they say you can go to, and basically you're not going to get anything approved on a major surgery basis unless it's pre-authorized. And basically you're going to have 4 levels of appeal if that's denied at the first, the second, the third. And basically they're denying, what was it, 25% in the OIG study, just routinely denying them. And less than 2% of the people even thought to go through the appeal process because it was that onerous on them. And you just imagine if you're laying in a hospital, your doctor says you need this surgery, it's going to solve it, but the health plan says, no, let's do another little test, let's see if we can get away with it, let's kick the can down the road, maybe they'll be off this Medicare Advantage plan after January, let's just wait. Especially if they do that on an automated routine basis and hope that you don't appeal it. But you're having to fight an appeal and fight an administrator and fight a medical director that's trying to save money from your hospital bed. So I take a little bit of issue with you saying, basically it's the same thing as original Medicare. No, the heck it's not.
Medicare Advantage plan, which is usually a private HMO or PPO plan that basically takes care of all of the Part A, Part B,
No, ma'am.
Advantage, for
Sorry.
example. The insurer takes care of your Part A and Part B benefits and also your Part D.
There you go again. They just take care of it. They take care of it to the extent that they want to take care of it. They approve what they want to approve. Now we're going to talk about that disenrollment period that they're now calling the open enrollment period. It's not open for anything. You can't just join a Medicare Advantage plan during January to March, but you can dang sure disenroll from one. And
Blue card, but you want additional coverage. So supplement or Medigap policies cover what Medicare covers and where Medicare goes. So a very common one is like a Blue Cross Blue Shield Medicare Supplement. These you can use all over the country, wherever you go. Any doctor or facility that you go to that takes Medicare
Freedom I was
will
talking
take
about.
your supplement. With Advantage plans, they tend to have networks.
They tend to.
So this coverage is sort of more portable if you travel around a lot.
Yep.
With these plans,
Now here's what she's talking about, the parity between plans, the standardization that is Medicare Supplement plans. And it's very critical because, as I say this all the time, it's nice to be backed up and, repeated by other people in our
for the
industry.
same kind of things as a Plan G from another company. So it lets you compare and contrast a little bit more easily.
So the plan from one company is the same exact plan from another company. That's true. That leaves two things remaining. What kind of customer service are you going to get when you call on the phone? Is it going to be some tiny rinky-dink company that just started yesterday and they're in the honeymoon phase, which allows them to make the rates really, really low to get started for a couple of years, and then they rebound in the smaller companies, and then they often outsource their customer service, so you don't know who's going to answer the phone. It could be the same person answering the phone for your company as answering it for 30 other companies, and they just really don't care. We've had dealings with that, and we don't sell those companies, but here's that part again.
Supplement plans to one another. Because, for example, a Plan G from one company has to cover the same kind of things as a Plan G from another company.
All right, let's skip to this part here.
With a supplement, there are generally no network limitations. This means you can travel to Donnie and my home state of Texas and go see somebody there, and if they take Medicare, they'll take your supplement. With Advantage plans, they typically have a network that you try to stay in that network. Now, that doesn't mean that you won't be covered if you go somewhere and you have an emergency. Emergencies are covered and all that, but generally they have.
So we're going to talk about that in just a second. You're going to see an audience member here stand up and ask a question that a lot of people ask. A lot of people ask us this question all the time. What happens if I travel? What happens if I spend 4 months out of my service area on a Medicare Advantage plan? I want those zero premium plans, but man, I also want my freedom and flexibility. If you've got a PPO plan, typically you're okay as long as you don't change your address. You've just got exposure to about 50% more out-of-pocket costs, about 45% higher maximum out-of-pocket, typically a $10,000 out-of-pocket is the PPO side of it if you're operating outside the network. But I want to skip ahead to this part where they get something majorly wrong, and it's this really young girl talking about the donut hole and what's happening there. So let's skip to it.
I don't know. I know that people have heard a lot about the donut hole. That actually is gone. There's no more donut hole. It's finally done. Instead, there's kind of this phase, they call it the coverage gap.
They call it now the coverage gap. They used to call it the donut hole. The donut hole, the coverage gap, the donut hole, and the coverage gap are the same exact thing. That's why they call it a gap. That's the hole. That's the gap. It's still there, folks. There was some literature saying it was going to be gone, but it's still there. You're still exposed to 25% of the whole cost of the drug. That's It's better than 37%, but it's still a donut hole. I don't understand why people read that and then they see it right in front of their face that the coverage gap still exists and then say, see, it's gone, let's celebrate. It's still there.
But you're still getting, you're not losing your coverage like you used to. You're just paying 25% of the prescription cost.
Same.
So technically, in the phases after your initial coverage, there's a point where you get into this coverage gap.
Called the donut
and that
hole.
point is where you and your prescription drug company have paid $4,020 in prescription.
Right, so the donut hole's still there. Let me skip to the audience member who asked this question, and I'll try to translate for you because it's kind of a little bit hard to hear.
And I spend 4 months out of the year in Asheville, North Carolina, which I do. Is that a problem?
So you're not going to be able, if you had an emergency in Asheville, you would be covered by your Advantage plan. But if you wanted to get regular care there and see a chiropractor or see a primary care, that wouldn't be covered unless you have like a PPO type of Advantage plan where they're like, we'll pay 50% of that out of network bill. But otherwise, you know, if you're planning on getting regular care in Asheville, maybe it might be like something to think about getting maybe like just a supplement that can move around easier. Because an Advantage plan, think of that as like a private, it's going to have that company made contracts with hospitals and doctors to negotiate prices. And so if you're moving out of network or if you're going to be out of network, those other doctors didn't necessarily negotiate prices with that company.
So yeah, if you're going to be traveling a lot, if you're going to be moving to another place for 4 months, like this gentleman was talking about Asheville that he goes to every year, beautiful place, Asheville, then you've got a problem if you're just on a Medicare Advantage HMO. There's no question. Finally, they give some good advice here for people who are on a Part D drug plan or even a Medicare Advantage plan that has Part D rolled into it. You better pay particular attention if you're just going to let that thing roll over into the next year. Big, careful attention, and here's one of the reasons why.
They might change how they cover it for the coming year, but they have to tell you that in the plan changes.
Right, so you have to pay particular attention to the plan changes, no doubt. And I want to show you this one. This was received by one of my clients. He sent a picture of it to us today. It says, "Dear Mark, premium for your drug plan is going from $26 to $56. Wow. 100% increase. So look at all the other plans that are out there. Now, if he did nothing with this plan, by the way, this was a partnership that they had done with Walmart. It was the cheapest plan out there. I believe it was 3 or 4 years ago. It was all the rage. However, it's done one of those rebound things now, and it's double the price. So if you do nothing with it thinking, well, I've still got the best plan out there, you may not. It may be kind of a sticker shock. Now, we do Part D drug plan reviews in our office only for our existing Medicare clients. Important that I remind everybody of that. We have people call us all the time. Hey, I signed up for Medicare Supplement through somebody else, but I want you to do my drug plan. We won't. We can only do the drug plans because we have limited capacity on time, people, and clients. We can't do them for everybody else, and it's a money-losing operation, so we just simply can't. Listen, I want to thank you for watching. I'm going to keep you apprised of anything that happens and changes in Medicare. I want to see things that are wrong, and I can show you where they're wrong. I want to bring that to your attention because so many people are left to their own devices. I had a lady last night just told me she was scared to death about making any change. And I don't want our senior population to be operating out of fear. Fear is the worst motivator to take a decision because when you make that decision based on fear, often it's the wrong one. Find somebody you trust, find an advisor that you can check out, you can vet their reviews, you can check their licensing status with the state, you can check with the insurance carriers, see if they've had any complaints. Hopefully they've been in business for a while and they know what they're doing. Or they've got resources like my agents do. They can reach out and tap into a vast array of experience in the industry where we can get problems solved for literally tens of thousands of seniors that we affect through this channel and other means. So thank you for watching. Please continue to further your education on Medicare because there are changes coming in Medicare. And I guarantee you this, if you're subscribed to this channel, you'll get access to them first, probably before even your other agents will. Thanks for watching. I'm Chris Westfall. If I can do anything for you, please reach out. Thank you. Bye-bye.